I think governments can assist in the development of social capital. It'd be strange if they couldn't. Scheffler and Brown, the authors of the paper I was introduced today at the start, suggests providing funding or fiscal encouragement, that's a tax break or that sort of thing, so that it's easier to build social capital. Yes, there's lots of evidence that if you tax people, tax an activity, you'll get less of it. If you subsidise an activity or reduce the taxes, you'll get more of the activity. So I think Scheffler and Brown are on safe territory saying this. Unfortunately, they don't go beyond this level of generality. I guess there are existing policies in some countries where they reward the very wealthy for being generous philanthropists by reducing their tax bill. So there's existing examples of that sort of behaviour by governments. Second thing that Scheffler and Brown identify, and I quote them directly, what governments could do is to generate enthusiasm among communities and their leaders to generate social capital. Now, I have to say I find this a vacuous statement. Politicians are probably the worst people to look to generate enthusiasm among communities. These days, there's such a high level of distrust. Maybe the politicians could add to social capital hugely by becoming more trustworthy. But I don't know. But I get the point that if you can get local communities to be much more enthusiastic about things and believe in the value of these activities, then you would hope to get more of these activities. I just don't quite see how governments can encourage this, but I'd be interested in your views. I mean, what makes things happen more I don't know, in a local context, you could build more halls that are open access. Any group who wants to can book time in the hall for a nominal fee or something like that. Maybe that would generate social capital. It would improve your measure of social capital because you could probably then have more organisations, more meetings, higher participation. But one hopes it might do more than that. Maybe there's loads of things here. Creating more public spaces. If we think of the direction we've gone in terms of urban development, we're using up spaces, building more rather than creating more public spaces. Or we've got public spaces where people no longer feel safe. We need to reclaim them so that people have confidence to be in them again. So maybe these are things. It's not that there aren't things we can do. I think it's knowing which ones to choose. Because the nature of almost any policy or attempt to increase social capital is it's going to require resources. Resources that are having to come from somewhere else. So you're having to give up something else somewhere else, give up some benefits somewhere else to get these benefits. But the problem is, if the decision maker then says, well, show me the benefits that investing in this social capital will produce, it can be quite difficult to come up with the evidence. Doesn't mean it doesn't exist, that the benefits don't exist, but it can be difficult to come up with the evidence. And that was actually my last slide, because I want to hear more from you guys. This literally is what health economists have said. Most of them have been silent about policy. Yeah, please.
I have a question.
Please.
Is there any kind of attempts to evaluate the social capital and its relation to health qualitatively, like interviewing or depending on qualitative data? Or is it always about measuring by numbers?
In the health economics literature, it's certainly measuring by numbers, it's quantitative. The political and sociological literature, it's not unquantitative, but it's less quantitative. But almost the whole thrust of social capital has been this sort of measuring something and then showing it going up and something else going up. Everything is susceptible to qualitative investigation, and probably there's quite a lot that can be learned. But the papers that are produced tend to be focusing on the numbers.
I know, because even in public health, it's usually like this. It's more trusted if you can see numbers. But no one can deny the importance of qualitative assessment, because sometimes you can find things that are not shown.
I wouldn't disagree with you. I'm agreeing with both statements. Sometimes you can find things out that you wouldn't find otherwise. And the statement you had just before it, that if you don't have the numbers, it's very hard to persuade people you've got evidence.
Yeah, they complete each other.
I think they do complement each other, yes. Yeah, I agree. The literature I'm most knowledgeable about is quantitative. I'm not saying there isn't qualitative work there, but, and clearly, a lot of the qualitative does feed in. I mean, if you're going to think, what on earth should I measure? You need to talk to people as to what they may believe or not believe does influence their level of trust, for example, things like that. So, yes, I think you've got to do the qualitative work, but I think maybe it's easier to publish research that's quantitative. I mean, that's a very cynical view, but maybe it is. Mm-hmm.
In the UK, is there any real example to evaluate the policies to increase social capital?
I think the answer to that is
in the UK,
yes.
in London.
I think there's increased interest in evaluating policies that build or sustain social capital, but there's not a lot of understanding as to how to do it. So, for example, I know that in London itself, which is a big city of about 8 million, the local government are increasingly interested in how sort of urban space, environment, transportation, and all sorts of factors come together to produce more healthy cities.
Yeah.
And so they are getting more interested in that, but there isn't a sort of recipe book or a sort of toolbox or a sort of plan that says, right, if you're interested in this, you need to do this. So the stage I think we've reached, particularly in London, is there's a willingness to see that things are much more interrelated, but they're not quite, I think it would be fair to say they're not quite sure how to operationalise that and move it forward. So, for example, there's quite a lot of interest in recent years in air pollution, and in the last year or two particularly worrying about exhaust from diesel engines. Up until a few years ago, UK policy was to encourage diesel engines because they thought that it was somehow less damaging to the environment than petrol engines. It's not, it's more damaging, and so now they are grappling with what can we do to tackle this and what set of policies to adopt. And so I think it's not that there's not a will to move, I'll say move forward, that's a value judgment. It's not, there is a will, there's just, people are unsure about how to collect appropriate evidence, how to design appropriate policies.
I have asked my question because the UK has developed such a method in the London Olympics in 2012 because they did a lot of development in East London to hold the
Mhm.
Olympic Games. So I thought the UK government or London government has done something to
They have funded some research. Some of my colleagues I'm in the Faculty of Public Health and Policy. Some of my colleagues have research projects arising directly out of the London Olympics, and they're interested in the sort of legacy. Now, originally, the legacy they're more concerned about was a sort of sporting legacy, that you know, the demonstration effect of the Olympics and the excitement might encourage young children to become more active and take up sport and continue doing it. Increasingly, they're also thinking about the legacy in terms of holding the Olympics is not just an event, but you're changing the infrastructure in a part of London that was relatively low-income part of London. And what are the benefits of improving transportation, improving job opportunities, building more houses and things like that, creating new green spaces. So that is actively being researched.
The whole development has increased social capital in London.
The Olympics, you mean? Or I guess it... I think there was some initial evidence of increased participation in sport. Now, whether that was down to holding the Olympics or so happened, unusually enough, the British team did quite well, you know, across the board in all sorts of different sports. And whether that was the sort of the catalyst, I don't know. As far as I can make out, that aspect of increasing interest in exercise and exercise levels and participation seems to have faded a bit. Seems to be a bit short-lived. What we perhaps wait to see is whether the infrastructure changes have longer-term effects. Of course, Tokyo is hosting Olympics in 2020. 2020. So maybe there's a research opportunity there. Although, is the approach to take existing facilities and reuse them, or is there going to be a big redevelopment going on? Does anyone know?
Like there could be like some side, like in the side of the forest, so like it could make it easier for like a foreign living in Japan.
All right. So the social capital of foreign people living in Japan will increase. Could this alienate some groups in Japan and their social capital goes down? What sort of other policies do you think we could do? It's a bit drastic to hold the Olympics. I mean, I'm not saying I'm not against Olympics, but you know, if city after city in the world, it doesn't have to just be cities, want to increase social capital, what are appropriate policies?
Promote for less stress in work environment.
Oh, right. Yes. It's a work-life balance thing. Yeah? You're in the right country to start. Yes. Then we'd all have more time for each other, perhaps. Or even just more time for ourselves, which might be good.
Or for our family.
Yes.
They're part of our social
Mhm.
capital.
So, what about restricting working hours then?
It doesn't work much. Like, I mean, it's, for example, 7 or 8 hours that you must work, but there are some people who are working like up to 12 hours a
Mhm.
day. So it's not only about laws. It should be a promotion for restricting working hours. In a society, I think in Japan, working is really highly appreciated by community, by society, by norms. rather than laws.
All right, yes. You'd have to, if you want to do something in Japan about work-life balance, you'd have to change the norm.
Or promoting. It's not just the law. The government should do something about that.
Mm-hmm. What about more radical policies? I mean, that's fairly radical, but
Pushing people to leave. I don't know.
what about greater sexual or gender equality? Might that improve social capital?
In what sense?
Maybe it would deteriorate it. If you increase gender equality and don't do something about work-life balance, you're just encouraging and giving women the opportunity to become just as hopeless as men in terms of work-life balance. No, I think I was thinking it's a big leap. But you know the idea that the sort of financial crisis that we had a number of years ago and we're still living with, if the boardrooms had been full of women, there's been a suggestion that we might not have got to where we got to, but because it was largely full of middle-aged men, things were worse than they needed to be. Well, is there something similar with gender equality, and maybe it's a good way of building social capital?
I have an interesting example. It's not measured, but it's just a personal observation. I am from Yemen, and this country, as you might know, recently is facing a big disastrous challenge. Before that, the woman's role was not that much important in the business world. She is working as officer, teacher, doctor, but not too much into business. But lately, they started to come up with innovative ideas for business. They created new markets with very simple things, like doing, for example, themes for parties or baking cakes for events. And they started, this community of ladies who are doing business is increasing massively. And so they started to improve their social capital in different ways. So the disaster in this case was productive of them. Nobody suggested, it just happened. And the norm of gender inequality, which is very common in our societies, has not changed as well. But the situation, the economy, pushed them to do that. And so they created new opportunities without changing the norms. So I don't know if gender, it's important, but I don't know.
Because, I mean, well, hardly my expertise, but I'm just thinking greater gender equality might allow women more flexibility in the sort of relationships they build, and more relationships, in which case you get more social capital, possibly.
Perhaps.
Well, maybe it's too radical a suggestion. Let's stick to building community halls and...
Okay.
Any other ideas or comments? I find it quite interesting that you're not overflowing with suggestions for how we could build social capital. I mean,
in China, recent years, that we find that some elder or over 40 years old women like dance in the plaza after dinner. I think that is a very good way. That, but sometimes the sounds, that the noise makes the surrounding that they dislike it. So the media give the pressure on the society or on those groups to. They may when they dance in the plaza, that maybe they will feel guilty or something. That. But I'm not sure whether that if they control the sounds or some other way, that I guess it is a very good way, because many people come out and they dance, they feel very happy and they can do exercise.
it sounds such a win-win suggestion for governments, because what's it going to cost them? Nothing. I suppose the only danger is these citizens coming out might speak to each other more, which may not be what governments want. But I get the point, yeah, exercise. I guess you build trust. You have more relationships, more people. So back to our example of one of the mechanisms for improved health, about information and access to services. Oh. Okay, well, I think on that optimistic note, although it's a few minutes to go, let's think of all these citizens in China dancing in the plaza. Oh.
Yeah, just a little question or comment.
Sure.
I'm from the Democratic Republic of Congo, and I know in terms of healthcare, people mostly rely on the community because the health insurance scheme is basically in existence. So I wonder in this context where there is already a sort of existing social capital, because people build on that to access the service. And is it really important to think about building another social capital, or maybe it's important to think of more pressing needs, like how to improve infrastructure, the number of doctors or healthcare personnel. So in this context, social capital is not really going to add anything.
Okay, I think that's an interesting comment. I think there's two things I would say. One is there might be a distinction between where there's just somehow not enough social capital already, and so any investments we make, we're not getting the full benefit because there just isn't enough social capital to sort of combine with our investments. And situations where we have social capital, it exists and it's adequate level. So there might be that distinction. Yes, if you invest in social capital, it's going to take up resources, and those are resources which could have been paying for, more healthcare workers or whatever, or just ensuring that pharmacies have drugs on the shelves and things like that. So it's very hard to argue against that view. I suppose my point as a health economist would be, I think we need to somehow have evidence about how well different things contribute to improving health. I've got an open mind as to whether investing in social capital is a cost-effective method. It may be effective, but it may be high cost to get that benefit. I don't know. I come back to the not smoking in public places and changing the social norm. I suspect that was highly cost-effective. So it may be that there's some investments in social capital that are really good value, and many that aren't. But it's going to be very much, yes, I think what you're emphasising to some extent, and also with comment from Yemen, is we can talk in general terms about these concepts, but the context matters. And any time we start talking about policies, we really have to think about context that you're introducing the policy into. What works in one country what works in one part of one country may be inappropriate elsewhere. Yeah. Okay. Right, well, so we finished now. This is the right time, isn't it? We did start it, yeah. I wouldn't want to... I'm either half an hour late or half an hour early. So we resume for lectures 5 and 6 on Wednesday at the same time in the same room. Okay?